We move to Dr. Nattachai Srisawat, who is the project director of Tropical Medicine Cluster, Chulalongkorn University. And he is also the director of Excellence Center for Critical Care and Nephrology at King Chulalongkorn Memorial Hospital, Thai Red Cross Society. And he also joined the Division of Nephrology Department of Medicine, Faculty of Medicine, Chulalongkorn University. And his topic today is rather tough name, dengue and COVID-19, double trouble. Dr. Nattachai, please.
Thank you, Professor Usa, for your kind introduction. And I would like to thank you, the organizing committee, for inviting me to share our experience and idea about the double trouble between dengue and the COVID-19 infections. And this is the outline of my presentation. I think there are three major aspects between COVID-19 and the dengue infection. We start from the first one on the clinical manifestation and diagnosis. The first aspect, I would like to focus in the clinical aspect in terms of misdiagnosis between dengue and COVID-19. I think the misdiagnosis between COVID-19 and dengue infection has a lot of impact to the outcome of our patients. For example, if we misdiagnose COVID-19 patient as a dengue infection, the consequence will be like we can put our hospital or our communities to the more SARS-CoV-2 virus and causing the outbreak. Moreover, if we misdiagnose, we may delay the proper investigation, including the chest X-ray or CT scan for the COVID-19 patients. And also including, we may delay our effective treatment, including the antiviral treatment or the steroid therapy. And we may put our patient into the risk of COVID-19 complications like ARDS or cytokine storm. On the other hand, if we misdiagnose our dengue patient as COVID-19 infections, we may put our dengue patient also due to the unnecessary exposed to the SARS-CoV-2 virus environment in the hospital or in the state quarantine. And also our patient may unnecessarily exposed to antiviral treatment or steroid therapy. And again, we may put our patient into the risk of bleeding or liver or kidney failure complications. So diagnosis, the proper diagnosis between COVID-19 and dengue is very, very important. This is the data shown from the Wuhan report in the early of the COVID-19 pandemic. As you can see that many symptoms of COVID-19, mild to moderate, share a common feature with other viral infection, including dengue infection, such as the fever, fatigue, or malaise, or any body pain. Not only the clinical feature, but also the laboratory feature, like leukopenia, lymphocytosis, and thrombocytopenia, also very common in the early COVID-19 infection, and this may cause our misdiagnosis when we confront with this kind of the findings. Another manifestation of the COVID-19 may make us confused with such as some skin manifestation that is very common in dengue infection, like the petechiae that has also been reported in the case of the COVID-19 infections. This paper also from Thailand, from our university, show the skin manifestation of COVID-19 confirmed cases. As you can see that the major two skin manifestation in COVID-19 that we found is like the urticaria and the maculopapular rash. And this is the photograph of the 13 case confirmed COVID-19 infections, including the urticaria and the MP rash that also has been reported in our dengue infection also. Let's move from the clinical and laboratory feature that we also now move to the serology that may cross reactivity between COVID-19 and our dengue infections. This may be happen because of the cross reactivity between anti-dengue virus antibody and SARS-CoV-2 virus antigen. and also maybe because of the shared common antigenic similarity between SARS-CoV-2 virus and dengue virus. The first two case report is coming from Singapore in the Lancet Infectious Disease. And the first case, as you can see, that is a 50-year-old man who present with the fever and thrombocytopenia. At the first, he was diagnosed as a dengue infection from the rapid test, and he was sent to home and have a worsening of the symptom. With finally, he got the pneumonia and then the PCR for the SARS-CoV-2 virus become positive. Another case also from the same report also show the same finding that the first initial diagnosis is from the rapid test of dengue show the positive result, and finally return to be the SARS-CoV-2 virus positive when the symptom progress. When we look into the serological assay of the dengue virus rapid test, you can see that most of the rapid tests for dengue is focusing in the structural protein we call the envelope protein. In terms of the SARS-CoV-2 virus rapid test, mainly also focusing in the receptor binding protein. That is the main focus of the rapid test. And the recent report in the clinical infectious disease, CID has showed the potential antigenic cross-reactivity between SARS-CoV-2 virus and dengue virus by using an in silico method. In this study, they have the 55 SARS-CoV-2 virus confirmed case and another 95 dengue confirmed case. And they test the test with both of the dengue, West Nile, and SARS-CoV-2 virus rapid test. And then they use the simulation to find out the structural analysis between SARS-CoV-2 and COVID-19 virus. As you can see from this table, this is a dengue confirmed case. When we test this patient with the rapid test for the SARS-CoV-2, they can have a false positive of the SARS-CoV-2 virus in range from 22%. And also, this is another brand also show the cross-reactivity at 6%. When perform the simulation analysis using the in silico protein structure analysis, in this study they show that in the SARS-CoV-2 virus at the part of the HR2 domain of the spike protein may share some several cross-antigenic similarity with the envelope protein of dengue virus and also the Zika virus. So clearly we have some evidence to support some structural or antigenic similarity. For the future direction, we still don't know this kind of the shared common structural similarity, also share some cross-reactivity in terms of the functional activity. And also this kind of the functional activity maybe cause worsening or can improve a disease. We still don't know, and we're still waiting for the future analysis. And this may be answered by perform like a functional assay, like a plaque reduction neutralizing test or PRNT. We're still waiting for this kind of the result. The second aspect that I would like to focus is the common or the pathophysiology or pathogenesis between COVID-19 and the dengue virus. The plasma leakage and thrombocytopenia is a common feature of dengue as we know. In SARS-CoV-2 virus also share a prominent of the vascular leakage and also thrombocytopenia from the activation of the macrophage and endothelial cell damage also. For the coagulopathy, as you know that the thrombocytopenia is the major finding, and this. On the other hand, the COVID-19, the hypercoagulable state and the venous thromboembolism show the prominent features. The NS1 antigen is one of the main or the key finding to cause the endothelial damage and plasma leakage in the COVID-19. And this one can also stimulate the macrophage and cause a cytokine storm. Recent data from the meta-analysis show that in the the cytokine storm also share with the pathogenesis of the plasma leakage in the severe dengue infection. And this is the list of the cytokine panel that show the significantly difference between severe and non-severe dengue infections. And also, as we know that the hemophagocytosis is also very common in the severe dengue infection. We have the persistent fever for more than 7 days, and this is a report from Malaysia, and so another report from the South Korea. In terms of COVID-19, as you may know that the cytokine storm is also the common features, and also many hypotheses also try to point out that another feature that may prominent in the COVID-19 also the macrophage activating syndrome or the hemophagocytosis may play another role in the severe COVID-19 also. This is the cytokine profiling, the report from China also that show the increase similar to the storm in the COVID-19. Our group also have a chance to explore another the activator we call that is the endotoxin, maybe another major role in the severe COVID-19. We have tested the endotoxin activity assay in nearly 20 cases of the COVID-19 case, and we show that in the severe COVID-19 they also not only the viral infection but also show the evidence of the positive and at the high level of the endotoxin activity assay. And so we hypothesize that in the COVID-19, the SARS-CoV-2 virus caused the break of the intestinal barrier and caused the bacterial translocation and caused endotoxemia. And finally, the endotoxin may be another activator of the cytokine storm in the severe COVID-19. When we look back into the data of in dengue infection, they also have the report nearly 10 years ago also from the Indonesia and Netherlands groups clearly show that endotoxin also play a role in the severe dengue infection. The patient who have dengue hemorrhagic fever or dengue shock syndrome has significantly higher level of the endotoxin level also. As from this hypothesis, we believe that this is another, the endotoxin also another common marker of severe infection between dengue and COVID-19. We're still waiting for more results to show the causal effect, not only the association effect. In terms of coagulopathy, as I mentioned earlier, that in COVID-19, the anti-phospholipid antibody has been shown to become another major role and cause hypercoagulable state in COVID-19 infection. And now we move to the third aspect that I would like to mention is about the treatment. In COVID-19, we have fluid management as a main treatment, including the supportive care. We have the antiviral agent like remdesivir or favipiravir for the antiviral treatment. We also have many potential treatment like a steroid, anti-inflammation like a tocilizumab and the monoclonal antibody. In terms of the dengue, we still have only the fluid management and the base supportive care. We still wait for the antiviral and any other potential treatment. But I think with the robust research in the field of COVID-19 and with the previous slide that I mentioned that COVID-19 and dengue infection may share some common pathogenesis. So I think with the robust research in the field of COVID-19 that have put some shed light on in the treatment for dengue infection also, especially in terms of the role of anti-inflammatory agent like a corticosteroid and the role of the monoclonal antibody. When we look into the pathway of the cytokine storm in the SARS-CoV-2 virus, you can see that the respiratory support still the mainstay, but we have many potential treatment, including antiviral agent, anti-inflammatory treatment, and also the organ support. Steroid has been published that have the role in the severe COVID-19. That is the data from the recovery trial that show the dexamethasone can improve mortality in the severe COVID-19 patient, especially in the patient who need oxygen support and also the need the invasive mechanical ventilations. So overall, steroid can improve outcome in the severe COVID-19 infection. And also another treatment that show the potential and show the promising result is the anti-IL-6 inhibitor or tocilizumab. That also just published the data from the recovery trial again about a month ago. In the patient who have the oxygen less than 92% with the CRP more than 75, tocilizumab clearly show the survival benefit for the patients. So the benefit will be focused in the patient who have the oxygen saturation below 92 and also have the very high CRP level. And the CRP level in this study has an average around 140 and the ferritin about 1000. So this is maybe corticosteroid and the tocilizumab. Maybe in terms of the dengue infection may have another role, including also the role of the monoclonal antibody and the convalescent plasma. So the corticosteroid has been studied in the field of dengue infection since 1970. It's already more than 40 years. And there are so many research has tried to study the role of the corticosteroid in dengue infection, including in they apply the corticosteroid in the early phase or intermediate or in the late stage. This is the table summary about the results of the previous study of the corticosteroid. This is the study in the early phase. We still show the conflicting results. This is the table summary about to apply steroid in the intermediate stage. Again, still show the conflicting results. And lastly, this table shows the summary of the corticosteroid in the late stage. But most of the study of corticosteroid in dengue infection in the past using the sample size is rather small when compared to study in COVID-19 era. That you can see that from the recovery trial, normally the number up to like 1,000 and they can show the benefit. And most of the study of the corticosteroid in severe COVID-19 also apply them at the early phase, not in the late stage. Another potential treatment, and we get many knowledge also from the COVID-19 infection era is monoclonal antibody. Monoclonal antibody in COVID-19 infection will block the SARS-CoV-2 virus to binding to the receptor and fusion into the cell. And this is a way to prevent the replication of the virus. Currently, there are many manufacturers doing the investigation on the efficacy of the monoclonal antibody and show the promising results. For example, Eli Lilly, and including the Regeneron that use the cocktail therapy to treat in the President Trump and show the promising results. Another monoclonal antibody also come from the GSK and also show the promising result when applied in the early phase. And this is the ongoing of all the monoclonal antibody in the cocktail form that try to apply the treatment in the early phase of the COVID-19 infections. This also may be another target for the drugs for the dengue infection. This study is the report in Science just published early this year, also to identify the monoclonal antibody to the dengue virus NS1 protein. And in this cocktail therapy, they also show the promising results in the animal study. So monoclonal antibody has extensive research in the COVID-19, more than 100 monoclonal antibody right now in the market that in the research ongoing, and in the future maybe also can be applied in the field of COVID-19. And we also hope that this also may be another potential treatment for early phase of the dengue infections. So the problem of how to apply anti-inflammatory drugs like a steroid or monoclonal antibody in dengue infection still debatable. We also need to know more about how to apply them, what is the better timing, who is to get the most benefit, likely to be the people who have the early infection phase, what is the dosage, high or low dose, and how often that we should apply or how long that we should apply this kind of the anti-inflammatory drugs. So in conclusion, COVID-19 share a common clinical manifestation with the dengue infections. Many rapid tests of COVID-19 also show cross-reactivity to dengue rapid tests. Cytokine storm is a common feature in both disease. And the role of anti-inflammatory therapy, like the steroid, is still in dengue infection, need to be explored more in the near future. Thank you very much for your attention.